My name is Rebecca Lilly, and I will be doing my disability project on acromegaly. Acromegaly is a rare disease that affects 50 to 70 out of every million people in the U.S. The term acromegaly comes from the Greek word acro, which means extremities, and megaly, which means enlargement. As the name suggests, acromegaly can be recognized by abnormal growth of the hands and feet, as well as other signs such as the enlargement of facial features. However, acromegaly also involves changes in the way the body functions. Over time, these changes can cause complications that can be life-threatening. These risks make it important to obtain and maintain control of the condition once it has been diagnosed. Acromegaly is caused by prolonged overproduction of growth hormone by the pituitary gland. The pituitary is a small gland at the base of the brain that produces important hormones to control body functions such as growth and development, reproduction, and metabolism. Growth hormone is part of a cascade of hormones that, as the name implies, regulates the physical growth of the body. If the pituitary continues to make growth hormone dependent, one of the normal regulatory mechanics, the level of insulin growth factor continues to rise, leading to bone growth and organ enlargement. The excess growth hormone also causes changes in sugar and lipid metabolism and can cause diabetes. In over 90% of acromegaly patients, the overgrowth of growth hormone is caused by a benign tumor in the pituitary gland. These tumors produce excess growth hormone and, as they expand, compress surrounding brain tissue such as the optic nerve. This expansion causes the headaches and visual disturbances that are often symptoms of acromegaly. In a few patients, acromegaly is not caused by the pituitary tumor, but by tumors of the pancreas, lungs, and adrenal glands. These tumors also lead to an excess of growth hormone, either because they produce growth hormone themselves or more frequently because they produce growth hormone releasing hormones that stimulate the pituitary to make growth hormone. One of the characteristics of acromegaly is that the facial features, lips, ears, nose, and forehead become broader and larger. At this time, the tongue enlarges, the space between the teeth increases, and the lower jaw grows, resulting in an underbite and extended lower jaw. During this time, a headache may be present. Facial hair growth also increases, which may be especially bothersome for women. Another characteristic of acromegaly is that the hands and feet are enlarged. This causes patients to have to wear larger size rings, gloves, and shoes. Also, there's an overgrowth of tissue in the wrist, which can compress the nerves in the hand. This causes pain and tingling in the fingers. Some other characteristics of acromegaly is that there is an excessive soft tissue growth in the throat and voice box, which leads to sleep apnea and a hoarse voice. Also, the skin becomes thickened, and there is an excessive sweating is common. There's an overgrowth of the ends of bones, which can cause damage to neighboring cartilage and lead to arthritis. Patients with acromegaly have an increased risk of developing non-cancerous tumors. Their heart disease is also increased, and so is diabetes. Patients with acromegaly can have their life expectancy decreased by 10 years if their growth hormone levels are not controlled and if diabetes is present. However, if they have both of these under control, you would have a normal life expectancy. Small pituitary abnormalities are common. During autopsies, they are found up to 25% of the U.S. population. However, these tumors rarely cause symptoms or produce excess growth hormone or other pituitary hormones. Scientists estimate that about 3 out of every million people develop acromegaly every year, and that 40 to 60 out of every million people suffer from the disease at any given time. However, the clinical diagnosis of acromegaly is often missed. Thus, these numbers underestimate the frequency of the disease. If acromegaly is suspected, a doctor must measure the growth hormone level in a person's blood to determine if it is elevated. However, a single measurement of an elevated blood growth hormone level is not enough to diagnose acromegaly. Because growth hormone is secreted by the pituitary in impulses, its concentration in the blood can vary widely from minute to minute. At a given moment, a person with acromegaly may have a normal growth hormone level, whereas a growth hormone level in a healthy person may be 5 times higher. Most accurate information is obtained when growth hormone is measured under conditions that normally suppresses growth hormone secretion. Healthcare professionals often use the oral glucose tolerance test to diagnose acromegaly because drinking 75 to 100 grams of glucose solution lowers blood growth hormone levels to less than 1 nanogram per milliliter in healthy people. In people with growth hormone overproduction, this suppression does not occur. The oral glucose tolerance test is a highly reliable method for confirming a diagnosis of acromegaly. After acromegaly has been diagnosed by measuring growth hormone levels, an MRI scan of the pituitary is used to locate and detect the size of the tumor causing growth hormone production. If a head scan fails to detect a pituitary tumor, the physician should look for non-pituitary ectopic tumors in the chest, abdomen, or pelvis as the cause of excess growth hormone. The presence of such tumors usually can be diagnosed by a CT scan of the possible tumor sites. Rarely does a pituitary tumor secreting growth hormone may be too tiny to detect even with a sensitive MRI scan. The goals of treatment of acromegaly are to reduce growth hormone production to normal levels, to relieve the pressure that the growing pituitary tumor exerts on the surrounding brain areas, to preserve normal pituitary function, and to reverse the symptoms of acromegaly. Currently, treatment options include surgical removal of the tumor, drug therapy, and radiation therapy of the pituitary. Surgery is a rapid and effective treatment. Even when surgery is successful and hormone levels return to normal, patients must be carefully monitored for years for possible reoccurrence. Most commonly, hormone levels may improve, but not return completely to normal. These patients may then require additional treatment, usually with medications. There are 2 drugs that are currently being used to treat acromegaly. These drugs reduce both growth hormone secretion and tumor size. Medical therapy is sometimes used to shrink large tumors before surgery. Radiation therapy has been used both as a primary treatment and combined with surgery or drugs. It is usually reserved for patients who have tumors remaining after surgery. These patients often receive medication to lower growth hormone levels. Radiation therapy is given in divided doses over 4 to 6 weeks. This treatment lowers growth hormone levels by about 50% over 2 to 5 years. Patients monitored for more than 5 years show significant further improvements. Radiation therapy causes a gradual loss of production of other pituitary hormones with time. Loss of vision and brain injury, which has been reported, are very rare complications of radiation treatment. No single treatment is effective for all patients. Treatment should be individualized depending on patients' characteristics such as age and tumor size. If the tumor has not yet invaded surrounding brain tissues, removal of the pituitary abnormality by an experienced neurosurgeon is usually the first choice. On the next slide, you will find resources for families with individuals suffering with acromegaly. These include websites that have more information about the disease and also ones that offer support throughout the country with individuals suffering from acromegaly.